Agents, Luis Moreno here with Simply Health Insurance Agency. Here is a question that I get quite a bit from my subscribers and from agents who want to get into this business. And the question is, should I do just ACA? Should I do just Medicare, or should I do both? Man, what a great question. I'm going to answer that question here. But before I do, here's what I want you to do. Subscribe to my channel. I'm growing it. Please, I could use your help growing and sharing it with your colleagues. Number two, like this video and comment. I respond to every comment. Okay, all right. Now, this is a really good question. Should I do both? Or one or the other? Me, I would do both. You know, it really depends on your clientele. Okay. If you're sitting with somebody who has Medicare, you put your Medicare hat on. Okay. If you're sitting with somebody who doesn't have Medicare but wants health insurance, you flip that hat around and you wear your ACA hat. Why walk away from some business? Okay. But it's just not that easy. Now, what does make it easy is this: healthcare, Medicare, the concepts are the same. Okay. You're going to have deductibles. You're going to have co-insurance. You're going to have co-payments. You're going to have a maximum out of pocket. You're going to have to deal with networks. You're going to have to deal with formularies. You're going to have to deal with PPOs, HMOs, EPOs. The underlying parts of both Medicare and ACA kind of the same. So there's a lot of transfer of the data. Okay. But then there's also there's a lot of specifics to each one. So you got to have the capability to know everything about Medicare. Okay. Know what those options are for those Medicare beneficiaries. And then you got to know ACA and what those options are. Okay. So, you know, would I do both? You know what? If you have the capability, sure. Why not? I would do it in sections. Okay. Now I love both. I have great books of business with both of them. I started in Medicare first, did a little bit of health insurance. Then Obamacare started in 2014. I rock and rolled and I have a huge book, 5 times the size of my ACA book, of my Medicare book. I have about 1,000 Medicare clients overall between Medicare Advantage and MedSup, but I've got about 5,000 ACA heads. Okay. And I've accumulated those in a very short amount of time. So I think ACA, you can acquire a bigger book quickly. Medicare, you can do the same. But it's not as quick and it's slow. Also, when you go into a household, the most that you're going to write is 2. Mom or Medicare beneficiary, the grandpa, whomever, and the spouse, and that's it. Okay. With ACA, man, you got the possibility of enrolling mom, dad, 4 kids, 5 kids, and you're going to get paid on each member. So you can grow your book a lot faster with ACA. Let's talk about money. Okay. Let's talk about some money. Okay. First, I'm going to show you the money that you can make with Medicare. Okay. Here is the 2024 comp schedule. If you are not in one of these states, okay, so nationally, the majority of us have to deal with Medicare Advantage, new business commissions, new to Medicare, $611. That's for new business, and that's what you'll make for the first year. Then, after the 12 months is up, it'll renew, and you start getting paid monthly commissions. So at that point, it's $306 for the whole year. Divide that by 12, $25 and change a month. The good thing is that we've gotten rate increases or commission increases past 5 years, as far as I can remember. So our commissions have gone up. If you live in Connecticut, Pennsylvania, DC, you make a lot more. Okay, $689 and then $345. And if you're in California, New Jersey, man, you're making $762 and then $381 on renewals. Okay. Medicare supplements, on average are about 20 to 22% commissions of what the premium is going to be. And then you have to pair it with a prescription drug plan. And if it's new, you make $100. And after the $100, you make 50. Okay. All right. Let's do some big number comparison here. All right. So let's get into this. And here's what I'm going to do. Okay. I'm going to put ACA right here. And I'm going to put Medicare over here. Okay. And let's say that you have 100 heads over here. And you have 100 Medicare heads. Okay. On average, we make about $25 per month. So that's going to be $2,500 times 12. I'm going to net for every 100 clients, I'm going to gross $30K a year. Let's do Medicare. Now, what I'm going to do on Medicare is it's going to be rare for you to write all new to Medicare. But I'm just going to compare renewal commissions, okay? And then you can assume that it can be better. You'll have more money if you do a lot of new to Medicare. So we make 100 clients and we make 301 per year times 100. Well, you're going to make $30,100. Man, you're making the same amount of money for ACA and Medicare. Now, if you do write some new to Medicare, okay, let's just say, you know, I'll put it over here. 25 of these are new, which is 601, and 75 were the renewals. Let me do some quick math here. 25 times 601. That is 15,025, and then 75 times 301. Over here, you're at 22,575 plus 15.025. All right. Well, now you're at a total of 37,600, assuming that you had about a quarter of that business being new to Medicare. So there is a little more money here. Now, there are some bonuses that we get with ACA, depending on your production, and those get very good, but I'm not going to count them. But Medicare has HRA money. It varies anywhere between an additional $75, I think, up to maybe $225, depending on your area, the carrier, and the product that you sell. Okay. But let's say that out of the 100, you did all HRAs and there's 75. Well, let's just do 100. Well, that's an extra 10K that you could make possibly on the products, assuming you're getting about 100. So the money gets very good with Medicare. Okay. It's not bad. All right. You could be over here anywhere between 40K, over here 47K. Over here, you're at 30. Depending on your production, you could get some bonuses. Bonuses are very good. But there's great money to be made on both of them. Now, the beauty of ACA is that this 100 may be a lot easier for me to acquire than this 100. Okay. You know, I may get 5 immediately off one household because I got mom, dad, and 3 kids. Now, I'm also going to sell dental and vision. I'm going to make money there. I'm also going to sell a hospital indemnity plan. But over here, I can also sell a hospital indemnity plan. I mean, to me, it looks like financially, man, why would I pick one over the other? As a new agent coming into the business, if you want to capitalize, write both of them. Now, here's what I would recommend. Okay. Start a little slow. The ACA is easier to acquire. Okay. So what I would do is I'd get your ACA contracts. Okay. And then we would, in addition to your ACA contracts, we would get your dental and vision contracts, we'd get your indemnity contracts for ACA. And then depending on whether you're in a federal state, federal, like when there's in the that participates in the marketplace, I think there's 33 states, you would go do a 1 hour, approximately about an hour certification, and it works for all those states. If you're in a state-based exchange like California, Colorado, I think Connecticut, Georgia will be there next year, and there's a whole list of them. You have to certify with your particular state and use that state's in quoting and enrollment platforms. And to my understanding, I haven't done one of those. I'm not in any state-based exchange, but the certification takes a couple of hours. I think California was like 8 hours, or maybe it was Colorado. And I was like, no, I don't have the time for that. So a lot easier to get started with ACA. Also, there's hardly any marketing rules. You do whatever you want. You can door knock ACA. You can put flyers on people's cars. You can host seminars. You can chase people down the aisle at the grocery stores. I mean, it does not matter. ACA has no marketing rules. Okay, now Medicare, get ready. You cannot solicit for Medicare. Okay, unless it's a Medicare supplement. But aside from that, they need to contact you. You cannot door knock. You cannot cold call. I mean, there is a ton of compliance rules that protect our seniors from predatory marketing. So that's why I say it's a little harder to build a Medicare book, but you should do both. Now, the other issue with this is on the Medicare side of contracting is that, well, contracting is not that easy. You have to do AHIP, which is like a master Medicare 101 class. It's going to take you about a week to do that. So it's very time consuming, and it really dives into the intricacies of Medicare. When you get done with that, you're going to understand Medicare. Also, you should know there's 50 questions on that test, and you got to score a 90. What happened to the freaking 70% passing? Not with AHIP. You got to score a 90 or better. Then you're like, oh, I'm done. Not even close. You have to certify with each carrier. So if you're going to get Medicare contracts, what I tell agents is let's start off with the big boys. Okay, the well-named carriers like United, Humana, Aetna, Cigna, maybe WellCare. And then once you get those done, and if it's necessary, you can grab the more regional carriers. Maybe they're super competitive in your area, but that's where we're at. So I hope I cleared up this question of should I do both? Okay, I would definitely say yes. Okay, do both, but don't go crazy and get a ton of contracts. Now, I will tell you for ACA, I'm going to recommend you get every carrier in that we have in that state. Okay, for sure. Okay, for Medicare, just a couple. Okay, then we'll add more. But you can do both. Now, remember, what do I provide? I become your upline. Okay, I have a training platform on school. We have over 800 agents in that platform. That platform is where I host all of my support and training for you guys. I have everything in there for you all. Okay, so I train and I support you. The other deal, and I don't know if you've been hearing my phone going ding, ding, ding. You usually try to get to it real quick. And some of the times it's client, but a lot of times it's agents texting me. Luis, I'm stuck. Can you help me? So if you're one of my agents, okay, I tell you all, look, if you're with a client, text me, call me, man, I'll get to you. Give me 5-10 minutes. I will get to you and I'll answer your question. If you're not with a client, please do me a favor. Post your question on school. We will get to it and we will answer. So guys, I hope that helps you out. Okay. There's a lot of money to be made with both lines of products. We are in the biggest, not season, but the biggest time period in history where We have more than 10,000 seniors turning 65 a day. Okay, it's probably 12,000. Those 10,000 has been a while back. We're getting up to the top, and it's going to start decreasing. But a lot of these seniors need help from great agents that are knowledgeable, they're trained, and they do the right thing. Okay, ACA, so Wild West out there, but also these people deserve to have good agents helping them out, choosing the right plans, and making sure that they're well taken care of. So either way, if you're coming in with a mentality of, look, I want to help, and I'm not all about the money, even though you will make it. I'm more about, I want to make sure that these insureds are enrolled in the right plans. I want to make sure that I've covered them completely. Want to make sure that they're well taken care of. You're going to make a ton of money. So if you like what I'm talking about, man, subscribe to the channel, like this video, give me your comments down below. And if you want to contract with me, I would love to have you. Hit me up on an email, and what I'll do is I will set you up with contracting, and then we'll get you in for training. We'll get you out selling. And if you need support, I'll be your guy. All right, guys, thank you so much.